This month is Stroke Awareness Month. It's an important time to focus on a health issue that impacts so many families in our community. Now, a stroke, it can happen suddenly, but recognizing the warning signs and seeking care quickly, y'all, it can make all the difference. So today I am joined by Prisma Health Neurologist Dr. Sandeep Gill to talk about what you need to know from early symptoms to why acting fast could save a life or prevent long-term disability. All right, thank you so much for joining us.
Thank you for having me.
Yes, okay, so let's lay the foundation by talking about what exactly is a stroke. Break it down for us.
Well, stroke, first and foremost, is a medical emergency. It's caused by a blood clot in the brain that leads to a lack of oxygen to a certain part of the brain. Depending on what part of the brain is involved, you can have very specific symptoms.
So how common are strokes in our community?
Strokes are very common. Colombia is in what we call the stroke belt,
Wow.
which is a geographic part of the nation where the incidence of strokes are much higher compared to the rest of the country.
Is there a reason why it is more common in our area, or is that still being studied?
It's being studied, but it's due to certain demographic factors and risk factors like high blood pressure, higher rates of smoking, diabetes, and high cholesterol.
All right, so people are hearing this and they're like, all right, I need to clearly be informed and understand what a stroke is. And so the biggest question that people have on their minds now is, what are some of the signs or symptoms of a stroke that you should never ignore?
Of course. The acronym that we emphasize is B FAST. B stands for balance, sudden onset difficulty walking, imbalance, stumbling, vertigo, room spinning sensation is a very classic stroke symptom. E stands for eyes, which sudden onset loss of vision. It can be blurry vision or double vision. F is for face, so facial asymmetry or drooping of one side of the face is a classic stroke symptom. You can test that at home by just having a loved one smile and looking to see if half of the face is activating. A is for arm. Weakness in the arm or leg is a classic stroke symptom. That can be, a flaccid arm, or it can be even as subtle as difficulty texting or using a fork or a spoon. S is for speech. And so slurred speech is most common, but also, not being able to understand what somebody's saying to you, not being able to produce speech or just think of the right words. And T is for time. It's time to go to the hospital if you notice any of these symptoms.
How quickly do people need to respond if they believe they're having a stroke or if their loved one is having a stroke? Immediately, or should they call their PCP or straight to 911?
Do not wait. Don't go to an urgent care. Don't try to drive yourself. Call 911 immediately because the therapies we can offer are time sensitive.
So be fast. I mean, literally, that's such a great acronym because you also need to be fast if you're experiencing any one of those symptoms.
Exactly.
Now, let's talk about who is most at risk for a stroke.
Typically we think of patients in their 50s, 60s, 70s with high blood pressure, diabetes, high cholesterol, and smoking is the biggest risk factor. But we see patients even younger than that. We have patients in their 20s and 30s that come in with strokes.
Wow.
And so it's very important not to ignore these symptoms, even if you are younger.
Yes. And so I'm going to get on my own little step stool here, my own little soapbox. Y'all, stop smoking. Please stop smoking. Please. One of the reasons why we shouldn't be vaping or smoking, it's just not good for you. All right. What are some steps that people can take, if there are any, to lower that risk of experiencing a stroke?
Well, like you said, smoking is the biggest risk factor. So stopping smoking immediately will have a huge impact on your stroke risk. Keeping up to date with your PCP appointments or your family doctor visits to make sure your blood pressure is in control, your cholesterol is well within normal limits, and that you don't have diabetes. And if you do, then making those lifestyle modifications and taking the appropriate medications to help lower that risk.
Absolutely. I know sometimes going to the doctor may not be the funnest thing. However, it is absolutely critical. Make sure you go to those appointments. Get the full, every time I go, I'm like, do everything. Take all the tests. I want all the labs, draw all the blood, because again, that's so important to know. Now, are there warning signs before a stroke happens, or do these things come on all of a sudden?
These come on all of a sudden. It's not uncommon to have situations where symptoms come on and then disappear after a few minutes. That is still not a reason to not go to the hospital. Even if those symptoms come and then go, that could be a warning sign that you are going to have a major stroke and to get to the hospital immediately.
All right, my friend. So this isn't anything that you want to delay with. Now, what are some treatment options that are available for people who experience a stroke?
Of course. So the two main treatment options that we can offer, one is a very powerful clot busting medication that we can
Hmm.
give. It's a blood thinner that helps break up the clot that's causing the stroke. The second is a treatment that we can offer where we go into the blood vessel with a catheter and actually pull the clot out of the brain that's causing the stroke. And like I said before, both of these are time sensitive, so
Yeah.
don't wait if you have any stroke symptoms.
Yeah, you rather be safe than sorry in this situation. And so one of the things about medicine that we all know, it improves so quickly. There are constant updates that are being made. It progresses quickly. How has stroke care changed over the years? How has it progressed?
Well, typically, stroke used to be a diagnosis where we would make the diagnosis and there we didn't have treatments that we could offer
Hmm.
acutely. And it was picking up the pieces afterwards and
Yeah.
trying to find out why this happened and trying to prevent the next one.
Hmm.
Now, especially over the last decade with the inclusion of thrombectomy, it's called, where we go in and pull the clot out, stroke care has been revolutionized where we can significantly reduce the disability associated with a stroke.
And speaking of the disability, what does recovery look like for somebody who undergoes a stroke? Short-term recovery or long-term recovery?
Mhm. Well, we know the recovery period is much shorter for patients that get these treatments, that get to the hospital quickly.
Hmm.
But even still, you're looking at a period of physical therapy,
Hmm.
occupational therapy, speech therapy for a year or longer, even when it comes to stroke recovery.
Yeah. So again, the biggest message that I'm getting right now, this is so time sensitive. Um, if somebody does have a stroke, what is the likelihood of them experiencing long-term symptoms? Because one thing that I think most people associate with strokes is maybe a drooping on the side of their face or on the
hmm
side of their body. How does somebody recover from that? What creates that as a something that people experience long term? Is it because they waited a little bit longer?
So strokes are of varying
Yeah.
severity, and patients with larger strokes that take too long to
Hmm.
get in certainly have worse disability and poorer recovery as a result of that. The folks that get in quickly and that we can treat quickly are the ones that do much better.
You were saying folks who have a larger stroke.
Mhm.
Can you break down the severity that a stroke can have? Can there be a small stroke, medium stroke? Explain that to us.
Of course, the most minor version of a stroke is maybe some numbness or
Hmm.
tingling on one side of the face or on one side of the body.
Hmm.
The most severe version of a stroke is not being able to move or speak.
Hmm.
And that can affect your dominant side of your body, for most people, which is the right side.
Yeah.
So you can imagine not being able to move your right arm or
Mm.
leg and not being able to speak or understand what's being said to you can be devastating.
What resources does Prisma Health offer for families and people who have experienced strokes?
Of course, yeah. So we have a very wide network of family practitioners that
Mhm.
follow along, and we have a great neurology outpatient practice where patients that have had a stroke come in with us regularly. We make sure that they're still getting the physical therapy and the occupational therapy that they need. And even beyond just the initial hospital phase, acute rehab, where patients can have 3 hours of physical therapy and occupational therapy and speech therapy a day, is somewhere that we often send patients that have had a stroke directly from the hospital before they go home.
Okay. And I also want to talk about stroke camp. What is that? Break that down for us.
So, Stroke Camp is an event that we have every year.
Yeah.
It's where stroke survivors come in and kind
Mm-hmm.
of present, their experience. And,
Yeah.
and it's really a way to raise awareness in the community and the importance of that be fast mnemonic and getting to the hospital in a timely manner.
Yes, stroke camp. I love that that is an option because I think when you actually meet people who have experienced this and you hear those stories, it really helps encourage folks to make sure that they are taking care of themselves and understanding be fast and what that means. And how can we as a community support those who have experienced a stroke? What's the best thing that we can do?
I think just being aware of those signs and symptoms is the biggest thing, and recognizing, in loved ones and even in yourself, if you're having these symptoms, get to the hospital. And, we really help our community by reducing the amount of disability associated with a stroke when we get patients to the hospital quickly.
Absolutely. All right, my friends, be fast. If there's anything that you take from this interview, know that time is of the essence. Be fast, remember it, understand the signs and the symptoms, because that is a way that you can help make a difference when it comes to South Carolina, the Midlands, and where we fall when it comes to stroke cases in the United States. We want to have better numbers. We want to see this not be such a large thing that impacts our community. So it's so important to be informed and aware.